بسم الله الرحمن الرحيم. تكملة محاضرة المرة الماضية اللي هي vesicular rashes and then infectious vesicular rashes, and then we will start the second topic inshallah. So another thing very common, I doubt that if you go into practice that you won't see this every year. You will see hand, foot and mouth every year. Occurs in outbreaks typically in schools. Hi, we had one a few months ago. I'm in السنة So I don't know about last year مع الكورونا. So children were not going to daycares. So I don't know if we had a significant outbreak this year or last year. But typically the outbreak عادة presents the optimal condition for growth. عشان هيك أطفال المدرسة، أطفال الحضانات والمدارس، وأول ما يجي بيكونوا as you know they have come off, they were weaned off their mom's IgG by 6 months. قاعد بيت أهله من 6 months ل whatever 3 years. أهله كلهم مطعمين، كلهم صار معهم الأمراض. So they are all protected. So they form a protective shell around them. هلا بروحوا الأطفال على المدارس. So there is no protective shell. بصيروا يصيروا عندهم التهابات وينقلوها لبعضها. Now that's not a bad thing. that's their environment, and that's how they build up their immunity. One of the common things اللي هو عدا عن ال HSV راح يشوفوا عدا عن البكتيريا الفرنجايتس وغيره. One of the things that they will see is hand, foot and mouth disease. Children under 10 are the ones who are mostly affected, more so under 5. The causative agents are Coxsackie virus, A16. This is an enterovirus. This is the dominant one. This is probably what you will see. Both of them are enteroviruses, and both of them are, if you recall from last semester, enteroviruses will always usually be transmitted through fecal-oral route. So enterovirus 71 has been associated with encephalitis and myocarditis. شو معناته؟ معناته لما تشوف مريض تحكي له يعني this is probably hand, foot and mouth disease blah blah blah. بالنهاية بدك تعطيهم دائما the red flag signs. إذا صار معه neurological symptoms مثلا drowsy, he's sleepy, photophobia. هالأشياء بدك تحكي لهم، بدك تعطيهم الsymptoms so that you can spread the net and bring in your patients who might have worrisome symptoms. Children typically mount a less aggressive immunological response than adults. شو يعني؟ هذا حكينا من الحلقة الماضية. So this is actually how their immune system works. حكيناها بالإيميولوجي الفصل الماضي. Children typically mount a less aggressive response to everything because they are categorizing diseases, and they are عندهم الثايمس بيكون كتير كبير صح؟ So they are categorizing, they are building immunity against illnesses. فهذا this is something very common للviral illnesses. حكينا مثلا بالchicken pox. So this may be beneficial since the immune system is naive and being exposed for the first time for a large number of pathogens. تمام. The atypical disease راح يكون بالhigher age group. So immune system is more competent, will be more aggressive, and you will have a severe presentation. Caused by Coxsackie A6, tamam, can have severe presentation with fever, arthralgia, and flu-like symptoms, with rash as vesicles that affect the nose, cheeks, extensor surfaces of the arms and the legs, buttocks, and the groin region. Fecal-oral route or direct contact. تمام. So signs and symptoms, upper respiratory tract symptoms before the skin lesions occur. You may not see these skin lesions. يعني or maybe بيكونوا كتير مختلفين. وعلى فكرة skin lesions are very hard to see in darker skinned people than in lighter skinned people. وفي صار يطلعوا هلا sort of atlases that are aimed at looking and training the eye on darker skinned people because it may look different. So So with fever, malaise, and pharyngitis is probably what you will see first. The rash is typically on the soles and palms and buttocks. Soles and palms طبعا هذا يعني من الأشياء الغريبة إنك تشوفها، مش كتير بتشوف أشياء that affect the soles and the palms, and especially not at the same time. So عشان اسمه hand, foot, and mouth disease. المouth شو راح يكون؟ Football shaped, painful vesicles that involves the buccal mucosa and the tongue. It spares the posterior pharynx اللي هو, which you may see in the angina, which spares the anterior pharynx. Skin, red papules that progress to gray vesicles on the soles and palms of the and buttocks. هاي شكلهم. So you will see these. I'm very sure you will see these on a yearly basis. حوالين المouth, the soles and the palms. Treatment, only symptomatic treatment, ما له treatment معين. Must maintain hydration. This is essential as in all fevers. وحكينا طبعا بدك تعطيهم red flag signs as it may carry a risk for encephalitis. Smallpox. Smallpox, alhamdulillah, is one of the eliminated diseases. As you recall, it's caused by variola virus, which is an orthopox virus, a true pox virus. So there are two strains, variola major and variola minor. Variola major was a very very bad disease. أنا ما شفته. I would probably think الجنريشن قبلنا شافوه. So at least شافوه أو at least سمعوا عنه, يعني سمعوا عن cases. Because the last case reported was in 1977. So اللي فيكم بيعرف مثلا دكتور عاصم شابي, ممكن الدكتور عاصم شابي يحكي لك مثلا عن تاريخه, مثلا شو شاف, because he was doing his postgraduate work بالسبعينات. So and the virus was declared eradicated by the WHO in 1980. So do not confuse these claims, شوفهم, which are usually chickenpox outbreaks or measles that may happen in anti-vax groups. So الحمد لله ما في شيء smallpox, although بنخاف مثلا انه مثلا في بعض المختبرات لسه عندها عينات من ال smallpox that are kept. واحدة من عينات اكتشفوها بالغلط وهم قاعدين بنقلوا مختبر بأمريكا من مختبر لمختبر, لقوا عينات مش was not labeled. They tested them, turned out to be smallpox, so that could have been an outbreak right there. بالاتحاد السوفيتي السابق, هلا دول ثانية صارت اسمها أوكرانيا وهالدول الثانية. Some of them had labs that still carry smallpox. People who died of smallpox, if their corpses were to be exhumed, كمان that carries a risk. So we always have our hands on the pulse again for this case. So this is something that may worry some people as a bioterrorism agent. The incubation period is about less than 2 weeks. It's followed by a prodromal period of about 2 days, and then you get a centrifugal rash. Is initially maculopapular and progresses to pustules, vesicles, pustules, and scabs. Death may occur with fulminant disease. Diagnosis can be confirmed by عادة PCR. Maybe you can do electron microscopy, and there is no specific treatment. It's only supportive. فهي شكلها smallpox, and can leave يعني it can pretty much disappear. It may leave some scarring. ORF is caused by a DNA virus. It is related to smallpox, and also called sore mouth infection. Infects the fingers of individuals who work, هاي كنا حكينا هنا المحاضرة الأولى, who work around animals, farm animals, so goats, sheep, usually transmitted by coming into contact with infected animals, petting them, feeding them, milking them, harnessing them, whatever. So but can be also transmitted between people, من animal to human, then human to human. There is no treatment again. However, the papules may become infected, and then you will need to treat the infected here, the break of the skin. It can be the same farmer can be infected multiple times, so there is no lasting immunity, and has 6 stages from small papules to about ulcers and crusts. So this is what it might look like tiny macule, then papule vesicle, تكبر بتصير cloudy vesicle, might ulcer, and then scab over like this. This is an infected animal. This is what they would look like. تمام. Okay. Molluscum. Molluscum, virus-induced vesicles عادة on the skin of healthy and immunocompromised individuals. بتشوفوها أكثر بالimmunocompromised individuals، وخاصة يعني بتشوفوا مثلا مرضى بهالجروب you will see them more likely to see these mollusci on them. Most common presentation between the 2 and 11-year-olds and adults as part of a sexually transmitted, but because it is direct contact. عادة direct contact يعني between people تعرفوا إنه مثلا all over the skin it's usually by sexual practice. It's not transmitted by sexual fluids, rather by the direct contact. And عادة إذا بيحكوا direct contact usually through a sexual contact. عشان هيك it can be part of a sexual transmitted disease. Single or small clusters of vesicles, less than 30, raised papules which may look like vesicle. الأشياء اللي بتميزها بالعادة they are not erythematous بالأغلبهم they're not erythematous, skin colored and have a tiny dimple or a central umbilication on the vesicle itself. Face and trunk, pubis, and rarely mucosa. They resolve on their own. Sometimes they may last for years, and then you can do cryotherapy. And cryotherapy أتوقع يعني you all know it. So they use tiny needle with liquid nitrogen, and then can freeze off the skin, and then the skin will break off. إذا حدا عندكم عمره اشتغل liquid nitrogen, liquid nitrogen, it is so cold لما when you drop a protein in it or a sample or tissue بتسمع له صوت زي كأنك حطيته بزيت محمى، يعني صوت آلي، بصير زي صوت آلي بيطلع منه. And it can preserve proteins يعني for later use. فإذا مثلا بدك تعمل a protein that you want to use as a therapy عادة نحطه بliquid nitrogen. Anyways, if associated with HIV, it can become very severe. Complications عادة ما في شيء، بس maybe you may have scarring, especially if manipulated bacterial infections, conjunctivitis for those that are near the eyes. So this is what they look like. Very very typical يعني mollusci. This one might have a little bit central dimple here, another one here. افتحوا على جوجل شوف قد ما بدكم صور. More around here. Okay. Now definitions of infective skin lesions, macules حكيناه هاي الصورة, because now we are moving towards crusted lesions. So crusted lesions نطلع على الأنواع diseases. طبعا أنا ما راح I will go not through all of them, but I will go through the majority of them, and I will keep the rest for you to see them. يعني if you want to تستزيد من المعلومات. So eczema, impetigo, we will talk about them. هاي الأنواع أغلبهم تشوفهم they are all are bacteria or fungal causes. So ringworm, impetigo راح نحكي عنها. Sporotrichosis هذا ما بنشوفها عندنا كثير. Histoplasmosis, you may see it. Coccidomycosis, blastomycosis as part of مثلا الدكتور شو بنشافوا بأمريكا هدول. Leishmania بنشوفها عندنا. Cutaneous tuberculosis بنشوفها. Maybe nocardiosis, very rare as well. I will not go through all of them. I will go through the most common of these. And impetigo, caused by Staph aureus or group A strep, usually skin flora with local trauma that allows the colonization of the bacteria to break through. Commonly affects children in tropical and subtropical regions. ليش tropical and subtropical regions؟ لأنه عادة if you think about it in cold weather الناس بتكون لابسين أواعي ومغطين حالهم, so there's less chance to have skin breakage. يعني إنه بيكون عادة أطفال، معناته أطفال بيلعبوا بالحديقة، بيلعبوا بالشجر أو شو، بيجرحوا حالهم and they might have these skin infections with their skin flora. It is the most common bacterial skin infection in children. 70% are non-bullous and appear as crusted lesions. It is highly contagious, scratching towels, clothing, auto-infection, and spreads in daycares. Okay. Features clinically occurs on the face and extremities. Lesions start as small macule, papule, erythematous vesicles, and then flaccid bulli which rupture, they release their fluid, and that fluid will crust over. It's usually seen with regional lymphadenopathy and can cause cellulitis, deeper infection, which you want to. Another thing here that you might tell patients إذا تطور الالتهاب، كبر، صار احمرار أكثر، صار في ألم. So these are red flag signs. Post-trip glomerulonephritis, تذكروها. So this is another red flag that you want to give the patient. That you want to tell them about also any other symptoms that may include urinary symptoms. Treatment, topical agents for most cases. Mupirocin is the best topical agent. And if you recall, mupirocin is what we can use alongside surgical scrub اللي هو chlorhexidine, so that you can use as a decolonizer for MRSA. Patients who have numerous lesions who do not respond to topical treatment should receive oral antibiotics. راح تعطيهم شو؟ The anti-staph medication, so flucloxacillin, dicloxacillin, or cephalexin. MRSA, again, sulfatry, doxycycline, again. So هاي بذكروها من المحاضرة اللي أخذناها الفصل الماضي. So that's what you want to worry about. Impetigo, surgical wound infection, poor skin hygiene, failure to follow aseptic procedures. وهاي الأشياء that you want to talk about. والstrep اللي هو acute glomerulonephritis is what we worried about here. Okay. So this is what it usually looks like. This is the honey crusting. عادة يعني maybe another thing that you want to talk about. عادة يعني this can indicate how well the child is being taken care of. فإذا بتشوف طفل بيجيك مرة مرتين دائما impetigo وإذا إجاك, you might think that the parents might not take good care of the patient. هاي من الأشياء اللي ممكن تنحط مثلا again to social services. Sometimes إنه عنده recurrent impetigo مثلا أو الطفل nobody is cleaning them because it is very hygiene dependent. Again more you can see يعني طبعا جاي على scratch زي كان الطفل scratch himself. يعني مش not if someone has it إنه معناته this is لأنه الطفل نفسه is unhygienic كتير بيلعبوا مع بعض. But خاصة recurrent and يعني very gross looking like this يعني كتير كبيرة. So you might يعني at least give some pointers to the parents that they might يعني improve the hygiene أكثر للطفل. eczema. So حكيناها المرة الماضية تذكروا pseudomonas. So these are punched out ulcers surrounded by raised deep red and violet margins invades into the dermis. Caused by عادة staph or strep, but may occur with اللي حكيناها pseudomonas in neutropenic patients. So difference from impetigo, this is the deeper form of impetigo. It can progress and then start as an eczema. Empiric treatment, anti-staph medication, and then unless cultures yield cystococci alone, in this case penicillin alone is good. Deeper form, topical treatment would not be used. Anti-pseudomonal, piperacillin, tigracillin, tazobactam, all these can be used. فهي a patient with multiple eczemas. You can see very red on the sides, and then a crater, an ulcer that forms. These are not typical sites for diabetic foot. So, and then diabetic foot is usually not multiple ulcers, other than one big ulcer that keeps progressing. And the very redness and surrounding erythema is not that typical in diabetic foot. So these are things that might help you differentiate them. Dermatophytes, they were mentioned briefly الفصل الماضي, and again we will just expand a little bit on this subject. A group of fungi, more than one, مجموعة كبيرة من الفنجاي, that all connection betweenهم إنهم بيعيشوا على dead keratin of the skin. شو وين الكeratin موجود? Hair and nails and skin. So you will have nail infection, hair infection, and skin infection with these. They are spread by direct contact with patients or the soil. يعني عادة مثلا بتشوفوها بالأطفال اللي بيلعبوا بالحديقة كثير. الحدائق مثلا بتكون خاصة بالغرب, يعني حدائق بيلعبوا فيها الأطفال, بيلعبوا فيها كلاب وهذا الحكي, والأطفال بيلعبوا بالسويل, so they might get, this is how they get infected. You will see, I saw يعني dermatophyte كتير أكثر بالغرب من هنا, يعني probably because of, you know, they have these parks and stuff. Clinical classification is by age group. So children, they have tinea capitis, which is in scalp, and it's very common in the children and the most common in the children. Tinea corporis on the trunk, and then faciale on the face. Adolescents, tinea manum and pedis, palms and soles, athletic foot. أنا صار كبر بالعمر, صار بطل هون, كان طفل صغير بيلعب, and then now he is older, so athletic, and this is more common. Tinea unguium, which is on the nail, also known as onychomycosis. Then the adults, you know, wrestlers, beard, neck, groin. So this is what it looks like, very, very typical. So it looks like a crusted circular ring, and this is where the dermatophytes are growing, and this is the skin that they're eating. This is tinea capitis, and you can see this is the skin and the hair is being fed off, and then the skin, يعني child will lose this hair and might be permanent, يعني, so it might not grow back fully. Tinea Barbie, so مش باربي اللعبة, هو من مثلا بارباروسا, إذا سمعتوا عنه, البحار العثماني. باربا اللي هو beard, روسا red, so he had a red beard. فريدريك بارباروسا كان كمان ملك ألماني. The same thing, it's red beard. So here it is called tinea Barbie, as you can see. هذا هو أنا شو عنده? This is a very severe case of acne. So you want to differentiate the two. This has an infectious component, but it's not, the infection component is not the instigator for the فصار عنده hormonal issues, usually hormonal issues, and then the skin, there is typical bacteria that is found in acne that are opportunistic and become part of the pathology. They are not the instigator of the pathology. هون لا, this is an instigator. هذا بكون بحلق أو راح أو كان مثلا بالجيم أو بالفندق or whatever, and then he was using a razor, and then the razor had was infected, and then he gave it to himself. Another thing that you want to see can the demarcation lines. This is quite common, and you do not see these in acne. And then the small crusts as well, but still it might be it might give you a head scratch. You don't know, maybe is it or is it not, but these are things that may help. Tinea corporis, this is on the body. شو ممكن يعني تغلبك? And psoriasis usually have silvery scales. These are not usually not present as prominently as it is seen in psoriasis, and both have يعني their own way of diagnosis. هلا بنحكي لكم عنه. So diabetic foot, tinea unguium or onychomycosis. Diagnosis. So this is what can help you. هل هي psoriasis, هل هي acne, or whatever that might trouble you. So you can do a KOH mount for the skin scraping, and you can see hyphae. You will not see these, you only see them in tinea. So the goal is to distinguish dermatophys from other causes, and then infection caused by bacteria or non-infectious causes. Some species can fluoresce by a UV lamp, and culture is used when KOH preparation are negative. You can still do a culture, and these are the hyphae that we'll see under KOH mount. Very easy to see and view. Treatment: many local skin infections resolve spontaneously without chemotherapy. So you might you might not even see it, so the patient might not come. But if they come, you can use the اللي هو tolnaftate, allylamines or azoles. And these are topical treatment. أغلبهم اللي بيستخدمهم azoles are the dominant ones that أغلب الناس بيستخدمهم. nail bed infections أصعب كتير to treat. So things that you might use is griseofulvin or itraconazole, maybe combined with topical therapy. Therapy must be continued over weeks to months. بطول كتير to resolve. There is no specific preventive measures مثلا vaccines or such. ما في شيء. Okay, the next lesion that might look like a sort of a crusted lesion is cutaneous leishmaniasis. I'm not going to go through all the details of leishmania, which we covered in the previous semester, but we're going to go through the most important ones and then focus on the skin issue here. It is transmitted by sandflies. Okay, these are trypanosomes, not treponema, which is syphilis. These are trypanosomes. It's a parasite which has two forms: disease causing, which is the resistant form, and then an infectious motile form. So it is deemed as a neglected tropical illness. A lot of the illnesses that you see around the world are especially Africa and some of the Southeast Asian countries are less. There's less resources and less funding and less attention on them, rather than diseases that have plagued the Western world. فمثلا منهم TB, مع إنه TB is one of the most studied infectious agents. منهم leishmania, and then also obviously malaria. They are very severe illnesses. Leishmania is a neglected tropical illness more than the others, and it is the disease of the poor, the disease of those who don't have houses, those who don't have places to sleep, where they may be prone to being bitten by these sandflies. بالزمانات كانوا يسموها حبة بغداد because people in بغداد قبل الكهرباء they used to sleep on the roofs of their houses. كلنا تعرفوا الجو حار هناك. They used to get a lot bitten, and then they would have this cutaneous forms of leishmania, and a lot of them had it. فكانوا بيحكي إذا أنت ما عندك إياها أنت مش من أهل بغداد. So leishmania comes in three forms: visceral, or Kala-Azar, which is the serious form, and the mucocutaneous and the cutaneous forms. The cutaneous form has many types. An old world in Asia, Africa, and Europe, which has a long incubation time, which is in months. So a skin lesion on the face or leg, papules will become necrotic, and then pigmented scars. So a papule at the site of the bite, then a small nodule تشبه nodule تبعت الأورف, and then a painless ulcer will form, and then this ulcer will start to crust and then form a pigment on the crust. هذا هو أكثر إشي بيساعد. It's a painless ulcer and a pigmented crust. هذا كتير يعني you can say it's pathognomonic, بس it may not be that because فإنه بتساعدك كثير. يعني it's almost يعني it's not diagnostic, but it's يعني gives you a very high prediction. So it leaves an ugly scar after healing, which promotes social issues. بتصيروا هدول الناس منبوذين ونظروا لهم إنهم يعني less than. 2015 2/3 of the cutaneous leishmania cases occurred in about 6 countries: Afghanistan, Algeria, Brazil, Colombia, Iran, and Syria. So mucocutaneous leads to partial or total destruction of mucous membranes of the nose, mouth, or throat, and over 90% of those occur in South American countries as well as Ethiopia. So if you recall the forms of the trypanosomes, so from anamastygote, so paramastygote, promastygote, epimastygote, trypomastygote. These forms almost never get asked about in foreign exams, but this may show. وتشوف the full form بيحكي لك شو هو هذا. this it comes especially in the US Emily لأنهم بيجي عندهم cases من South America كثير, ف they might ask you someone who traveled from South America وصار معه كذا كذا كذا, and then might show you this a blood film or something where they can show you the full form. يعني mycology بشكل عام is not as high yield as bacteriology, but they still come as well as مثلا microdoses or blastomycosis. But this is what it looks like. That's the face of leishmania, cutaneous leishmania. Can ulcers, pigmented ulcer, and then can leave an ugly scar later on. هاي منطقتنا. What do we see? You can see alhamdulillah Jordan is almost nil. للأسف سوريا مع الحرب it has spiked. العراق والسعودية they still maintain their numbers as well. It's becoming an increasing problem around the country because of the reduced living standards للاجئين. Leishmania major and Leishmania tropics is the most common, and they resolve over months with the depressed scar that remains. It may resemble other skin lesions, nodular lymphangitis caused by waterborne pathogens, or أهم واحدة فيها يمكن Sporothrix and Nocardia. Mycobacterium marinum, I think we mentioned last semester. Nodular lymphangitis, about a million cases with about 20 to 30,000 deaths occur annually. Sporotrichosis, هاي هي sporotrichosis, one of many differentials. So it goes through the usually goes along the lymphatics, which is not typical for leishmania. They leave these large nodules. Some كمان Rose Gardner's disease, and can be transmitted by cats as well. So they leave these nodules. One of the things that you may want to know is that this does not go away on its own. It will stay for a while. May even last for years. And it can spread through the lymphatics. Diagnosis: you want to remove the crusts and take a scrape for microbiology, and then the biopsy to retrieve the organism and then detect under the microscope. CBC can show reduced cell count, يعني pancytopenia, مش red cell count عفوا, pancytopenia, so red, white, and all of them. Diagnosis is by culture, treatment, local heat to the area, and then pentavalent antimonials. These are a group of chemicals given for cutaneous leishmania. منها others that can also be given amphotericin B, pentamidine, oral, miltefosine, but you just want to know the antimonials, but is mainly important, given for a minimum of 20 days, maybe even longer. هلا خلينا ندخل في البلس في the agents that cause bullous disease. So bullous disease وطرقنا عنه شوية لما كنا نحكي عن scarlet skin syndrome, and then we mentioned gas gangrene, Clostridium species gram-positive rod, right? حكينا عن necrotizing fasciitis with group A strep, and then staph, scarlet skin syndrome. These are the main ones, and then there's Vibrio, vulnificus, which causes as well a bullous form of a disease. فهاي من الفصل الماضي. So you have pyogenic skin infection, impetigo. So we know that staph can cause scarlet skin syndrome, which is bullous disease, and then strep as well. هلا scarlet skin syndrome حكينا عنه. يعني you have this toxin. It's a toxin, exotoxin, exfoliating. Not all staph have it. If they happen to have it, and then they infect the baby, then this toxin will cause the disease to occur. عادة this toxin is transmitted to the bacteria from a phage group 2. That's how they acquire the ability to produce this toxin. And then it must be distinguished from TEN. But TEN primarily occurs in the adults, and there is mucous membrane involvement, and there is a drug induced عادة, and there is prodromal مثلا إذا كان HSP. Punch biopsy with frozen section is useful in making this distinction, since the cleavage plane is the stratum corneum, right? It's not it's in the strata of the epidermis and not between the epidermis and the dermis. يعني هذا أهم نقطة كتير. ممكن هذه كتير تيجي في امتحانات، إنه مثلا يحكي لك ورجيك صورة إنه البولي is formed within the epidermis، بيحكي لك is this suspected TEN، وبدك تتفرق فيها. يعني this could be a clincher in a question. Due to hematologic spread of staph exotoxin, that means there is a point of infection somewhere in the body. هذا الطفل ممكن عنده otitis media, respiratory tract infection, or a skin infection where the exotoxin is gaining access to the body, and as there is the exotoxin being spread around by the circular system, it spreads to the skin, and then from the skin keeps causing this exfoliation of the skin. Exfoliative toxin A and B, only about 5% of all staph carry these toxins. Breakdown here, the desmoglein 1 results in acantholysis, breakage of cell to cell adhesion. هاي برضو بيحبوها لأنها بتربط بين المايكرو والفسيولوجي. فممكن بحكي لك مثلا which is the structure that is involved in مثلا scarlet skin syndrome. So desmoglein, and then what is it called, acantholysis. ما بيجيك أسئلة خارجية مثلا أسئلة مثلا direct، بس يعني might depend on this, and they like questions that tie in different subjects together. فهاي هي the pathophysiology. So you have the stratum corneum, granulosum, spinosum, and basale. This is the desmoglein, and then desmoglein 1, which is on the top layers أكثر من the bottom layers. And then you will have the acantholysis, which leaves a large chunk of the epidermis intact. TEN will not be in the epidermis. TEN will be in between the epidermis and the dermis. So the bully will form right somewhere around here تحت البيزالي يعني. شو ضل هون ولا شيء خلص. This is what it looks like. بتشوفوها هاي I'm 100% sure you will see يعني in your practice a few times at least. Here more. Okay, fine. Symptoms preceded by prodromal illness. So there is حكينا point. فبدك تلاقيها البوينت انت عشان يعني تزيح البكتيريا عشان تبطل to produce to send in this toxin. Hold on. Okay. تمام. Acute phase hits, so they will have fever, malaise, obviously loss of fluids. ليش loss of fluids you want to worry about here more than usual? Because they may lose more fluids than normal in these bully that form. Signs: paper thin, peeling skin, large flaccid blisters, small inflexor creases. Mucous membranes are spared. Again تذكروها مش موجودة ب TEN or Stephen Johnson's. And positive Nikolsky sign, which detects acantholysis. This is Nikolsky sign. So إذا بتطلع هون, there is a blister here, right? And if you push on the edges of the blister and push towards the normal looking skin, you will spread the blister along. So this is called Nikolsky sign. Hi, كمان again, it is يعني a well-liked clinical sign that is usually يعني they like it, they like to ask about it. Okay, شو كمان هون خلاص. Okay, diagnosis: blood cultures are often positive. Skin biopsy will show typical acantholysis. In lab we can do exotoxin assay. يعني you can detect the protein in the lab easily. هل بتعمله؟ ما بتعمله. You can detect the presence of the gene that produces the toxin, or you can detect the toxin itself, which is easy. Treatment: you must admit this child. هذا مش ما بروحش هذا الولد، بدك تدخله على الاي سي يو or at least بضل بالوارد يعني. Systemic antibiotics are given, anti-staph or MRSA, and then systemic steroids, and then severe cases they might have to give immunoglobulins or plasmapheresis to remove the plasma with a toxin in it. TEN primarily seen in adults and is potentially fatal. Intravenous gamma globulin is a promising treatment for TEN. So you can see here the large bullous form as well. So both are bullous forms. Okay, that concludes this lecture. نكمل إن شاء الله المحاضرة القادمة. يعطيكم العافية.